stillbirth series was the beginning of global advocacy to address stillbirth, with almost 3 million stillbirths occurring after 28 weeks gestation every year, and with little or no action being taken to reduce these deaths, despite known effective interventions. Stillbirth was then acknowledged as a neglected tragedy and a global public problem. While a majority of the global burden lies in low and middle income countries, we highlighted in these series that action was also needed in high income countries to reduce the numbers of potentially avoidable deaths. We showed wide-ranging variation across developed countries and very slow progress. Australia's stillbirth rate ranked 15th, with very slow rate reduction. This was the impetus for change here in Australia. 6 countries achieved the stillbirth rate less than 2 per 1,000, and we aim to reduce our rates to match these best performing countries. The Stillbirth Centre for Research Excellence was established by the National Health and Medical Research Council in Australia on the back of the findings of the Lancet Stillbirth series in 2016. Our vision is to reduce devastating impact of stillbirth for women, families and the wider community in Australia and also across the globe in partnership with the International Stillbirth Alliance. Our CRE has 4 main priority areas, the first one being data to drive change. This program draws on existing and novel data systems to gain comprehensive, timely data to drive practice and policy. Novel approaches to prevention, we identify novel solutions through discovery science and carry out large-scale trials in stillbirth prevention. Priority area 3 is about implementing prevention strategies. So we provide scalable interventions to enable health services to reduce the gap between what is known and what is done in maternity care to reduce stillbirth. And finally, optimising bereavement care, where we generate the evidence base for implementation of effective parent-centred care following stillbirth or neonatal death across maternity services. These priority areas are underpinned by cross-cutting themes of equity, diversity, co-design, clinical education, and community awareness. Our presentation today will focus on the aspects of the National Action Plan addressed in Priority Area 3 and Priority Area 4. Examining the landscape of stillbirth in Australia, we noted that the numbers of stillbirths have not changed in more than 2 decades. And some communities, such as Aboriginal and Torres Strait Islanders, migrant refugee women, and those living in rural and remote regions were at much higher risk. We determined that about 20 to 30% of these deaths, particularly those in late gestation, were associated with suboptimal care. And these factors were largely around gaps between what is known and what is done in routine antenatal care. And this was the basis for developing the Safer Baby Bundle. Moving towards the National Action Plan for Stillbirth, this was released in December 2020 with a vision to reduce the number of stillbirths in Australia, raise community awareness and understanding of stillbirth, ensure high-quality bereavement care and support is available to families who experience stillbirth, and to reduce disparity in stillbirth rates and bereavement care between populations. The plan was a result of many years of parent advocacy in partnership with care providers and researchers at the Stillbirth CRE, and was made a reality by a politician who had a stillborn baby previously, Christina Keneally. And in her maiden speech in the Senate, in Parliament in 2018, she called for an inquiry into stillbirth. And this inquiry happened over about the following 12 months. And this fed into the actions in the National Action Plan, which you can find on the Stillbirth CRE website. One of the major actions of the National Action Plan is the Safer Baby Bundle. It is now a national initiative, including 5 evidence-based elements to address key areas where improved practice can reduce the number of stillborn babies. These 5 elements are listed here. And they are to support women to stop smoking early in pregnancy, to improve of women with fetal growth restriction, to improve awareness and management of decreased fetal movement, to ensure women are aware of the importance of side sleeping in late pregnancy, and to ensure the appropriate timing of birth for all women to reduce their risk of stillbirth while not increasing unnecessary harm. The goal was to reduce stillbirth in late gestation, 28 weeks onwards, by 20% by 2023. So how do we develop the Safer Baby Bundle? You can see the major steps here. On the left-hand side, identifying potential elements, selecting our final set of elements, developing our recommendations and resources for each element, and our final recommendations and resources. And the whole process took about 2 years to complete, or 1.5 years. And initially, we worked very closely with the Saving Babies Live Care Bundle at SACEL to get guidance on adapting the UK bundle to suit the Australian population. Firstly, we identified key pieces of the puzzle to ensure its success. And these were, as you see here, strong interdisciplinary collaboration and clinician buy-in, partnerships with policymakers and jurisdictional health departments, partnerships with parents and parent advocacy organisation, and with the Stillbirth CRE, providing the resources and working with health departments to support implementation. We invested considerable resources into developing and executing a promotion package, engaging a very clever marketing company. This included a national launch in Parliament House by the Australian Health Minister and numerous local site launches organised by enthusiastic champions such as these midwives working in a rural hospital. The resource package for maternity services included 2 e-learning modules, which were made available for free to all healthcare professionals, along with continuing professional development plans. The Safer Baby Bundle e-learning addresses the why, the what and the how of implementing the Safer Baby Bundle and each of the 5 elements. And the Improve program was provided to assist services to undertake high quality investigation and audit to monitor improvement. Safer Baby Bundle resource pack includes evidence-based education and support, such as care pathways, webinars on specific topics such as fetal growth restriction, and a masterclass for specific target audiences, such as this one on the slide for Aboriginal healthcare professionals. And these have been developing over time of the Safer Baby Bundle rollout based on need. We've consulted widely as rollout has continued and taken on board advice from maternity services about what they need to help with implementation. We've developed resources for women to complement the resources provided to healthcare professionals to make sure that that both healthcare professionals and women are on the same page and to promote shared decision making. We've we've now translated many of these resources into different languages and undertaking further work funded by the Department of Health to adapt these resources to suit priority populations such as Aboriginal and Torres Strait Islander women, migrant refugees. Resources for women and clinicians to help in making decisions about timing of birth were just recently released. This has been under development for some time now, and the target audience here are women at term without major pregnancy complications, those with risk factors, but excluding conditions such as diabetes or preeclampsia. So some resources are intended to be given in the first half of pregnancy for women about what is a planned birth and when might that be appropriate, and to confirm with women how important it is that babies go to full term, and advocating no birth before 39 weeks unless medically indicated. We've developed videos for antenatal clinic waiting rooms, and this has been done in partnership with the Australian Preterm Birth Alliance. Developed resources for healthcare professionals on how to have the conversation with women about options for timing of birth, and they're freely available, and the QR codes are on the slide here. To supplement the implementation of the Safer Baby Bundle, we partner with health departments and parent advocacy organisations to run awareness campaigns. The first targeted clinicians and women in maternity services in Victoria around Movements Matter, and we found an improvement in clinician and women's understanding and knowledge and behaviours around key evidence-based recommendations. Subsequently, Red Nose led a campaign which included, in addition to monitoring babies' movements, the importance of sleeping on side and smoking cessation. And this targeted women in the community of childbearing age, and it has shown.
Okay, so that was the end of our formal talks, and thanks very much, Professor Flenady, for giving us that talk on video and letting us hear what they're doing in Australia. I thought it was interesting, the kind of 4 areas. We shouldn't focus on them all, but I think we've kind of covered off 2 of them in terms of in this country with respect to perinatal mortality and stillbirth in specific, and that is we have lots of data that tells us the problems. We continually turn that data up on a regular basis. We're making recommendations. We probably have some novel approaches, although we could add some, as they have, to involve more and more people. Place that we've done very well with respect to bereavement care under the driving guidance from Professor Keelan O'Donoghue and the team working with her, including parents. But where we're pretty falling down pretty much all the time is on implementing the change. Last year's conference from AINPEC was actually a lot about implementing change. And I think that's where we have to perhaps focus. And I think we got a call to action on that today in a couple of places, particularly from Anne Toomey, when she was talking about us doing something about all the stuff that we're getting from Vaughan and things like that.